What's skin testing like?
Allergy skin testing is pretty simple. We bring patients in, we do skin testing with little scratches on the back to start out with, and within 15 minutes we start to see whether patients develop red itchy spots like mosquito bites, and those would be things that are positive.
So a positive skin test can identify different molds or just mold?
We test for a pretty wide range of molds.
So it can identify the specific ones that are causing problems.
Yes.
And then how do you figure out if that's the one that's inside the house or not, or if that's one that you usually find outside or inside? How do you take that information and decide if it's probably the culprit?
So we look at their history compared to what they're allergic to, and we know that a lot of molds are more common inside. We also have a lot of molds that would be present outside, especially on wet, rainy days. Ascospores, basidiospores, those are ones that we see outside when it's more humid or when we've had a lot of rain.
You must have had a lot of good training to say words like basidiospores and that type. So they all cause problems. They're in family of mold that can cause allergy problems. And you can identify them by skin testing.
We can.
Then what do you do? If you identified it, what do you do for it?
Once we've identified it, we can optimize treatment of patients who haven't responded well to initial therapy with medications, and we can start them on allergy shots.
Allergy shots, what do they do as far as mold goes?
We can help desensitize patients to molds or to things that they're allergic to, or help them build tolerance to these things by giving them increasing amounts of allergy shots and concentration over a period of time until they reach a maintenance dose, and then they can stay on that maintenance dose long term.
So if somebody breathes in mold, they sensitize their nose and lungs, and the allergy shots desensitize, build up tolerance.
Correct.
That way.